Today, let's learn the difference between hyperthyroidism and hypothyroidism. First, we're going to look at the signs and symptoms seen in these diseases. First is thyroid hormones. In hyperthyroidism, we will have an increased level of T3 and T4, but we will have a decrease in thyroid-stimulating hormones. So, in hypothyroidism, we will have the exact opposite. We have a decrease in thyroid hormones, which are T3 and T4, and an increase in thyroid-stimulating hormones. Let's look at the mood in hyperthyroidism. Since everything is hyper, these patients are hyperexcitable, or you can think of it as they have a hyper mood, and then in hypothyroidism, they have a decrease in energy, so they're going to be fatigued and possibly show depression. All right, let's look at the temperature in hyperthyroidism. Do you think they will be hot or cold?
Everything is increased, so they will have heat intolerance, and for hypothyroidism, you guessed it, they're going to have cold intolerance because their temperature is low.
Okay, let's look at the skin. Patients with hyperthyroidism tend to have very sweaty skin. This is because they have high sweat production, and for hypothyroidism, these patients tend to have really dry skin, which is because they have a low sweat production. Now let's look at hair. Patients with hyperthyroidism tend to have soft hair. This is because everything is increased and growing. As for hypothyroidism, these patients tend to have hair loss. Again, everything is decreasing. All right, let's look at appetite next.
In hyperthyroidism, they have an increase in appetite, and in hypothyroidism, they have the exact opposite, that they have a decrease in appetite. Okay, now let's look at the weight for hyperthyroidism. You will see weight loss. You're probably thinking, weight loss is not hyper, and this doesn't match with our hyperthink-high symptoms. But in hyperthyroidism, they have an increase in metabolism, so this is going to lead to weight loss, and in hypothyroidism, you can think weight gain.
Okay, let's look at the patient's eyes. Hyperthyroidism patients tend to have something called exophthalmos. This is when the eyes appear to be bulging due to fluid accumulation behind the eyes. And for hypothyroidism, you will see myxedema. This is swelling of the skin and underlying tissue, which will be seen in the eyes appearing as swelling eyes. Okay, let's look at the GI function.
Patients with hyperthyroidism have an increased GI function, which leads to diarrhea, and patients with hypothyroidism tend to have a decreased GI function, so you will see constipation. All right, let's look at our vital signs. We're going to look at the blood pressure and heart rate in hyperthyroidism. You guessed it, they have an increase in blood pressure and heart rate, and for hypothyroidism, they have the exact opposite, which is hypothink, low blood pressure and heart rate.
That's all for hyper versus hypothyroidism. You can see how to remember hyperthink high and hypothink low. This really helps you remember all the signs and symptoms seen in this disease. Don't forget to subscribe for more.